I'm Xiaotong Jiang. I'm pleased to present the impact of music on anxious patients awaiting surgery, which explore how playing music before surgery can affect patient anxiety level and the overall prospective experience. First, I will provide context including 4 steps of my study and the research gaps I am to fill. First steps, introduction. Patients awaiting surgery often experience high anxiety and stress, which can negatively affect their surgical experience and even outcomes. It is important to find ways to alleviate this anxiety, and one promising approach is the use of music before surgery. It is a growing interest in using music therapy in healthcare as a simple way to improve patient comfort. As an inject or alternative to medication for prospective anxiety. And main objective was to assess how music interventions affect patient anxiety level before surgery, and whether music also influence physiological stress response like heart rate or blood pressure. We also compare patient choose music versus standard music to see which is more effective with the goal of getting insights to improve priority care. Preoperative anxiety can lead to problems like higher heart rate, elevated blood pressure, and greater need for sedatives. If music can reduce this anxiety, it may less the need for medication and improve the patient overall experience, improving a more holistic approach to care. Despite encouraging studies, some question in mind. For example, what kind of music works best, how long it should play, and how to integrate music into routine care. This is uncertainties motivate my research. Okay, literature review. I reviewed existing studies on preparative music to see what was already known. This study examined how music affects patient anxiety, physiological response, and the patient satisfaction, providing a foundation of evidence. Almost all studies agree that calming music before surgery significantly reduce patient anxiety. Studies also show that patients listening to relaxing music can lower heart rate and the blood pressure before surgery, indicating a calmer physical status. Generally respond a more positive experience when music is part of the preventive care, likely before they feel calmer and better cared for. Methodology. A systematic literature review on this topic, researching for relevant studies on music and preparative anxiety, and selecting the most pertinent ones according to specific criteria. I include ones studies when patients listening to music before surgery and that report outcomes on preparative anxiety or patient comfort. I exclude any studies focusing on music during or after surgery, studies without clean dates on preparative anxiety outcomes, and any low-quality studies. I compare and synthesize the findings across the selected studies to identify common patterns and the key results. My review identified 4 key findings. Music is highly effective at reducing preparative anxiety. Patients who listen to music are constantly less anxious than those who do not, and one study even found music more calming than the standard sedative. Analyzing the music selection enhanced the effect. Patients who choose their own music experience greater anxiety reduced than those given a generic playlist. Timing and the duration are important. Music works best if stayed well before the procedure, around 50 and 70 meters ahead and continue for at least 50 and 20 meters. Music therapy is already being used in practice. Some hospitals offer prohibitive music to patients, and even mobile apps provide calming music, showing that it is a practical tool to help patients relax. I will discuss the broad implication of these findings. Music interventions are safe, non-invasive, and low cost, with no side effects, so they are easy to add to standard care, and the patient generally find them comforting. However, not every patient responds the same way, and there are practical issues. What relax one person may not help others, and the staff must ensure the music don't interfere with communication or routines. Music can complement sedatives. It has no side effects, and one study found it as effective as a sedative in calming patients, which means patients may need less medication. Implementing music is very inexpensive, and by reducing anxiety, it can shorten preparation times or reduce medication needs, save costs, and improve patient satisfaction. Hospitals should consider offering patient calming music as part of preoperative care. Providing music, for example, via headphones, can make the waiting experience much less stressful and more comfortable. The slide lists the key reference supporting my study findings. Thank you for watching. Have a nice day.